Hi, my dear students. Let us discuss MCQ from milestones in child health. So, in previous class, we have discussed almost 20 questions from this topic. Now, let us discuss remaining MCQ of it. Here we have the first question. At what age does a typical infant start social smell? At what age does a typical infant start social smell? And the answer is option B. At 2 months, the infant start social smell. Then, the next question. Why it is important to track the developmental milestone? Why it is important to track developmental milestone? For detecting delays early and for giving intervention, it is important to track the developmental milestones in children. Then next question, which of the following is a sensitive period concept in development? And the answer is B. Some skills easier to acquire at certain age is a sensitive period concept in development. The next question, a child who cannot stack 2 blocks by 15 months should be evaluated for fine motor or cognitive delay. The next question, at 18 months a child can typically answer C, throw a ball over hand. So this is a gross motor control we can observe at 18 months of age. The next question, which of the following is not a fine motor milestone by age 2? And the answer is C, snipping with the scissors is not a motor milestone we can observe by the age 2. So generally we can observe at the age 3 to 4 years of age. The next question, the term late walker is usually applied if the walking has not begun by. And the answer is B, 15 months. The next question, which milestone is more likely to be delayed in a child with a hearing impairment? And the answer is speech or babbling. So here is a critical for speech or language development. So impairment delays vocalization. Then a child count to 10 by age. And the answer is C, 5 years. Counting and basic number concept developments preschool years. Then next question. Which reflex is integrated or goes away by 4 to 6 months? The answer is stepping reflex or automatic walking goes away as voluntary walking develops. After voluntary walking develops, the next one, a child begins to show separation anxiety typically at a child begins to show separation anxiety typically at 9 months. Around 8 to 9 months, infant may protest when separated from caregiver. Which screening tool is used in India for developmental screening? The answer is Trivandrum Developmental Screening Chart. Is used at community level as well as primary level. The next question. By 5 years, a child drawing of a human figure should include how many body parts approximately? And the answer is 5 to 6 parts. Typically, the person draw shows head, body, arms, legs, etc. If at 6 months a baby cannot sit with support, what should be done? Refer for evaluation. So it is a reason for motor delay. So that's why refer for evaluation. The next question, which domain would be assessed by asking a child to name colors? And the answer is cognitive or language. So naming items test comes under cognitive or linguistic skill. The next question, at age 4, a child typically can copy a square. At 4-year-old can copy geometric shape, large vocabulary also, but also count 20 is letter. Which is an example of gross motor plus fine motor development together? And the answer is riding a tricycle. So require a balance, that is the gross motor, and pedal control also, that is the fine motor. So this is an example of gross motor plus fine motor. The next one, the proximo-distal trend means development. Proceed. The proximo-distal trend means development proceed. Center to extremities. Center to extremity called proximo-distal development. Then cephalocaudal development means from head to downwards. And answer C. From head to downwards called cephalocaudal development. The development from head to downwards. Then which of the following is true about development? Option B. The development proceeds from simple to complex. So this is a true statement regarding development. Which is a gross motor milestone achieved between 21 to 24 months? The answer is jumping forward. Around 2 years child begin to jump off floor. The next question, delay in which milestone would raise concern earliest? The answer is failure to turn to sound by 6 months age. So delay in early sensory or motor milestones are more alarming and promote evaluation. The next question, the Trivandrum development screening chart is used for screening in which age period? 0 to 2 years. The answer is 0 to 2 years, or in first 2 years the TDSC scale is used for screening. Which is not a factor influencing child development? The answer is shoe size. Actually, the development influenced by hereditary environment, nutrition, not by shoe size, physical trait. The next question, which milestone is primarily social or emotional? The answer is imitative play. Which milestone is primarily social or emotional? Imitative play considered as social or emotional milestone. So which is used for social emotional development. The next question, which milestone is a primarily social or emotional? Imitative play considered as emotional development milestone. The next question, a major gross motor milestone by age 2 is? Option C, walking upstairs using alternative feet. We can observe this milestone at the age of 2. Which reflex is present at birth and disappear by 1 year? Sorry. The answer is Palmer Grab's reflex. Is a primitive reflex present early and disappear as voluntary grabs develop. If a child has delays in 2 or more developmental domains, this is called global developmental delay. Delay in multiple domains called global developmental delay. The next question, which domain of milestone is assessed by understanding no or simple instructions? The answer is language or cognitive. This comprehension and following instruction is a part of cognitive and language development. Next question, growth in childhood follows which sequence? The answer both A and C. Proximo-distal, center to periphery, and cephalocaudal, head to foot. The next question, By age 6, children typically have acquired about what percentage of their adult height? The answer is 60%. By age 6, children typically reaches 60% of adult weight. Hand preference, right or left-handed, is typically stable by 3 to 4 years. Handnesses become more consistent around 3 to 4 years. Around 4 years, a child language milestone includes. The answer is B, asking why questions. Child at 4 years begin to ask many why questions and use more complex sentences. By age 5, a child should be able to. The answer is all the above. Skip on alternate feet, balance on one feet for several seconds, understand rules in games. So these are typical preschool milestones by 5 years of age. Arrange in increasing order the following cognitive milestones, and the answer is A. A, C, B, D. The next question, which cognitive milestone emerges first in typical development? The answer is make believe play. So pretend play appears in early childhood, that is 2 to 3 years. Conversation comes later, 7 years. The gross motor milestone of jumping with both feet off the ground is usually attained by 3 years. Many years children can jump or hop by 3 years. A preschool child 4 to 5 years typically can tie shoelace. Fine motor control allows tying shoes, reading and complex skill come later. Then at 3 years a child can usually. Answer A, use 3-word sentences. The next question, the ability to copy a circle generally developed by at 3 years. Drawing basic shapes begin at about 3 years. The next question, a child typically hops on one foot by which age? 4 to 5 years. At 4 to 5 years of age, the child hop on one foot. The next question, which of the following reflects fine motor skill in infancy? Bringing object to mouth. So that uses hand control and coordination. The next question, at what age should the child be referred if they have not started walking? Should be referred. And the answer is 18 months. Lack of walking by 18 months is considered delay. So earlier refer if additional concerns. The next question, by 12 months of an infant usually says 1 to 3 meaningful words. Early words begin around 9 to 12 months. Example, mama, dada. What is the expected gross motor milestone at 12 months? Walking independently. Many children begin independent steps around 12 months. Ranges between 9 to 15 months. The next question, object permanence or understanding that object out of sight still exist is usually at 9 months. Around 8 to 9 months, infants begin to search for hidden objects. The pincer grab typically develop around 9 months. So it is a fine motor control of pincer grab emerges at 9 months. By 6 months, an infant usually can transfer objects hand to hand. So at 6 months, infant often transfer objects between hands and sit with support. So this is about MCQ from milestones. So don't forget to subscribe, my dear students. Thank you.